So hello to all my dear aspirants, welcome you all to Sailtomdsacademy Dental Academy. I am Dr. Malay, Pediatric dentist and professor in College of Dental Sciences. So we are with the part 2 for the MCQ discussion regarding your NEET MDS, INICET and Govt. Dental Exam. Part 1 has already been uploaded, the link is in the description box and also at the end of the video. Now dear students, we are going to discuss MCQ also today and also a few image based radiology questions. So let's start. So it's a very good case based question. A 2-year-old girl is there. Okay, she has the following 3 problems: poor weight gain, failure to thrive and feeding difficulties. Mother also told that the daughter breathes noisily while resting. There is no medical history, or we can say no prenatal or postnatal history. When the dentist examined, if he or she found the enlarged protruded tongue, okay, and also the patient is not able to close her mouth completely, and you can find a kind of respiratory distress when a patient is placed in supine position. So which is the most likely complication of this patient condition if it remains untreated? So dear student, you can note out from the case history that the patient is suffering from macroglossia, and whenever such macroglossia is there, the chances of recurrent upper respiratory tract infection occur. Why? Because of mucosal drying. So here the correct answer is recurrent upper respiratory tract infection. You can learn or you can go through this description by pausing the video. Now dear students, few important image based question. So apical appearance, where you can see in case of the radiation caries. Okay dear student, then Arnold Hale you can see in case of the cleidocranial dysplasia. Then we have a ball in hand appearance, a very commonly asked xylographic appearance for the exam. Normally it is seen in case of the intrinsic salivary gland benign tumor. Why it happened, aspirant? Because when a tumor exists in the secretory portion, it is relatively large and they cause dislocation and pressure on the duct. That's why you can see ball in hand appearance. Okay dear students, then we go for the branchless fruit laden tree, commonly seen in case of the Sjogren syndrome. So you can see in picture A the normal xylographic appearance of salivary gland, and here the Sjogren syndrome appearance of salivary gland. Now bush in winter, most commonly bush in winter is seen in case of the submandibular salivary gland. Remember dear student, it is not a pathology, it is a normal appearance. A parotid gland will show tree in winter or leafless tree pattern, and submandibular gland will show bush in winter appearance. Why it occurs? Because the normal acini do not allow dye to enter and it is seen only in the ducts and ductus. So please dear student, try to remember this 5 to 6 important image based question for your oral radiology. And any dear students want to join for the exams and the thing, we have the following features on our course. Okay, you can DM me, the number is there in the description box and also on the screen. Okay dear students, remember there are no secrets to success. You have to go for the proper preparation, whether it is INICET, NEET MDS or government exam, and you have to work hard also. So that was from my side dear students. Any doubt, any problem you have, just let me know. Till then aspirants, take care. See you soon with the part 3 for the MCQ discussion series.